He is the president of the Uganda Medical Association. The conversation we'd like to unpack is largely concerning the compulsory vaccinations that are being thought about by the central government. There is talk within the circles of the government to tweak the Public Health Act to see to it that people who do not want to get vaccinated are forcefully, vaccinated in that regard. So what would the Constitution say about that? Would it say that it is okay to coerce people into taking these mandatory vaccinations? Well, what does it say? When I spoke to Sam Oledo, he said when it comes to mandatory vaccinations like polio, which have been tested, it is okay because polio has been tested and it is a problem. So if government is going to say we are instituting a polio vaccination door to door that is mandatory, it is okay. But when it comes to new diseases, new pandemics, new epidemics like COVID-19 that we do not know, he says government cannot force people to take medicine that has not been tested. That is Sam Oledo joining me right now. A very good morning, Sam Oledo. Thank you for joining me right there in Ishaka.
Yes, thank you so much for the great host. My regards and greetings to Ugandans out there in Ishaka. And we've been branch visit to emphasize professionalism, ethics among doctors, and to ensure that our doctors down there are actually given the encouragement and also the patient care is up to date. So we are glad as the entirety of Uganda Medical Association that glad to be on the show.
All right, Sam Oledo, help us, paint a picture of how the health sector in Uganda is actually performing. How are we doing in terms of, performance right here in Uganda?
Yes, thank you so much. The health sector, basically, in our national visits, it is in a dire need. One would call it, we are in a state of appalling. When we talk about staff gaps, of up to 60%. Can you believe the entire country, we have 40% of staffs employed as doctors in Uganda? 40%.
Yes.
It's the reason we have more than 651 doctors employed in this country. We have only 61 senior consultants employed in this nation. We have about 231 medical officers special grade, and consultants we have about 180. So this totals to not more than 2,000 doctors countrywide. And we've gone to different places in this nation. Actually, on Friday, we're in Bale, assessing Mbale Hospital and the doctors on ground. And for sure, there is a gap.
What did you see in Mbale?
Apparently, actually, like in Mbale particularly, you have even patients who are being managed on special clinics. I'll give an example, ENT, whereby you have those surgical emergencies done on those children. A child has swallowed the coin, swallowed the bead, and is affecting them or even an adult. And now we have even the only ENT surgeon who was in Eastern Uganda, in the name of Dr. Biso, being transferred to Mulago, promoted as a senior consultant. Now the whole of Eastern doesn't have an ENT surgeon. Can you believe that? We moved to Soroti, and Soroti is doing a great job with a number of surgeons, but people are still working as medical officers special grade. Can you believe that? You have senior people who work for 15 years and they've never been promoted at the level of consultant, at the level of senior consultant. Even those who have been heroes in surgery and are still at the same rate, those who are heroes in obstetrics and gynecology, they're still working as medical officers special grade. Those who are heroes in pediatrics, same falling down. Actually, we have a neurosurgeon who was transferred in the name of Dr. Ne from Uganda, transferred to Mulago, working as a medical special grade. Can you believe that? And now this Paul was in Moroto when we entered Karamoja. Oh my God, God have mercy upon our nation. Actually, it made me to recite Psalms 117. That, oh my God, may God have mercy upon our country. For sure, Moroto Karamoja is in a terrible state. Can you believe we went to a hospital, which on paper, yes, on paper, we have all doctors. On paper, yes. We found the actual doctors who were there. We had only 9 doctors, and 8 of them actually employed on contract by other NGOs. We have 4 of them who have been employed by Ministry of Health in the contract basis of COVID-19 to try to alleviate COVID-19. They've done a great job. Can you believe ever since September last year, they've never been paid their allowances? Can you believe they've never been paid their salary from December? Allowances is every time you see COVID patients in the CTU, you're paid an allowance. That one, they've forgotten ever since September. Then now the payment of salary ended in December. Can you believe that? And these are doctors who have chosen to, because of the gaps, they've distributed themselves in the relevant wards. And trust me, by June, 4 of those doctors are leaving Karamoja, Moroto, which is a regional referral hospital, and 3 of other doctors by August. Their contracts with those organizations supporting the hospitals is getting done. So medical officer in the entire Moroto Regional Referral Hospital come and we are watching. We cannot recruit these who have been tireless because Moroto is a hard to reach and hard to stay. There is nothing you can do in Moroto. And this was our suggestion as doctors. We said no. The president made very good pledges and the directives were very good. However, can we first implement some directives like the 10% tax reduction and the tax-free vehicles for these hard-to-reach areas? This can entice doctors to be in these places. You cannot expect to pay a doctor in Moroto, whereby it's only one bus which comes after 1 day, and is a place where you cannot do any other thing other than being in the hospital. You pay that doctor the same fee as that doctor in Kampala. Definitely, a doctor will go for an interview in Kampala, in Health Service Commission, and they will not show up in Moroto. It's the reason why you have only 1 medical officer. And actually, in the different disciplines, I'll give an example, say obstetrics and gynecology, we have only 1 senior consultant, 1 medical officer special grade, and 3 interns. That is the most staffed department. You go to internal medicine and pediatrics, no medical officer special grade, no consultant, only 1 medical officer. And then now you go to surgery. Surgery is blessed. He has a medical officer special grade and an orthopedic surgeon who are working as others are still working as medical officers. Can you believe that? Hard to reach places. And this is what we are saying. The 40% staff that is employed is not enough. The work which is meant to be done by 10 doctors is done by 4 doctors countrywide. We are saying no. We have over 2,000 doctors unemployed. We are having amidst plenty, for sure. And we have these places recuperated. Can we have the different hospitals have staffs to work on patients? And now, apparently doctors, we are glad National Medical Store is working with Uganda Medical Association to avail the different drug lists and the inventory. And we are glad that doctors now are in the different hospitals are being informed and given these drug lists that are available, that are distributed in their units. As Uganda Medical Association, we are ensuring that every unit, every health center, is the doctors in those facilities are aware of what drugs are available in the stores, so that we have relevant prescriptions. We do not want drug expiries. We do not want patients to line up and we say there are no drugs. Where there are drugs, we want to use them. However, there is a very big challenge in flexibility of the budgeting process of the drugs from National Medical Store. We must be flexible, that we must identify which diseases are most prevailing in which places, so that we can be able to avail those specific drugs. You cannot give antihypertensives as majority of the drugs in Karamoja. You have only about 15 patients who are hypertensive because of the nature of the environment itself. We had almost the whole ward was filled with TB patients. And this is because there's a lot of desirable things to be done, and you do not have a physician. Can you believe that? A physician in such facilities? So we are saying no. Uganda trained over 100 super specialists in 2018. Over 100. And there is a good policy generation. We write very beautiful policies, but at the end of the day, implementation becomes so appalling. We train over 100 senior consultants, senior specialists in different fields, like minimum access surgery, that many of them, when they came back, of lack of what to use, they're stuck in Mulago. They cannot go to other places. Can you believe just a laparoscopic set that can help minimum invasive surgery is less than 200 million? Can you believe that a CT scan that can help to guide management in diagnostics? I'll give a simple example. I was in Moroto. We were challenged that we couldn't travel back on Sunday, so I was involved in management of patients in the hospital. One patient came in with a road traffic accident. A border young man was involved in an accident with closed head injury. But good enough, the GCS was 15 out of 15. But I would imagine, I had to stitch him up and did surgical toilet. But I would imagine if this young man had, for example, cerebral hematoma, bleeding in the brain, in a facility where you don't have diagnostics like CT scan to observe what part of the brain is actually compromised. What is in such a state? The whole of Eastern has only one CT scan, which is in a private facility in Kumi. The whole of North is upholding nothing. And we are saying even the one in Mbarara was actually a donation. Can you believe that? A donation from some of the well-wishers. And it is the only CT scan which is supplying the whole of Eastern Uganda. A CT scan can go up to 4 billion shillings only. Can't you sacrifice only about 24 billion shillings and you have about 8 of them in the entire country? And now, what we are talking about is reality on the ground. Policies are made, implementation is zero. The biggest challenge we have in our nation here, individuals are so much upheld to informing the Fountain of Honor that everything is well. I'm here to inform the Fountain of Honor and the entire nation that health sector, if we do not rush and improve things, we are having a catastrophe in a short while. And that's why we are saying, please, can we improve service delivery? Can we have actual things done on ground, not paperwork, not just observation? Can we have actual things done on ground? If we are talking about the welfare of health workers and improved working conditions, you cannot be in a facility where you don't have what to use. I actually used disposable gloves on a condition which needed surgical gloves. Doctors in Kirudu there, they're using aprons, plastic aprons, not even theater gowns to work on patients. This is very absurd. Honestly, we need a total revamping of the health sector. If we cannot a national health insurance scheme, then can we improve service delivery?
If the two-year COVID-19 pandemic did not compel the central government to step up financing of the health sector, what will compel them to do so? You're talking about meager financing, lack of resources for the medical workers to do their jobs. It is actually a pain having to go through the education system. You study for more than 5 years, and then you get into the medical fraternity and you do not have the tools. You talked about the computer tomography scans not being in existence and many of these other resources. Talk to us about what would compel the central government to look at the health sector as that significant, sector that should be actually focused on.
Honestly, as Ugandans, we must act, whether we want it or not. We must revise the healthcare financing. And this is where we talk about the issue of the National Health Insurance Scheme. Whether we want it or not, we must address the issue of Ugandans in whatever capacity they are in to be able to give a support to the health sector. We have 7% of the national budget, which is being earmarked for health. That is not enough. We have not even gone up to Abuja of 15% of the national budget because we have other sectors which are demanding. The truth of the matter is we must be able to negotiate and talk about the National Health Insurance Scheme. The only biggest elephant in this discussion is, have we cleaned up the health sector enough? You saw scenarios which happened in the National Referral Hospital. This is not exempted to other hospitals. Please, it is not exempted. Indeed. And that's why we are saying a total cleanup of the entire system, the entire health sector. Can we have a cleanup? And can we have a cleaned system which is going to come in this National Health Insurance Scheme that we are able to finance our own health sector? We must be able, Ugandans, we must be able to contribute a funding to support the national health sector. Otherwise, for sure, the government is overwhelmed.
That is Sam Oledo. the president of the Uganda Medical Association. Let's also talk about the COVID-19 pandemic. Even though the medical workers were working, over time with meager resources, they were able to clamp down on the infections that were rising within the country. As of the 13th of March, we recorded only 13 cases of COVID-19. Previously, only 11 cases of COVID-19. At Mulago and various health centers, we have only 11 patients that are grappling with the COVID-19 disease, meaning the medical workers, irrespective of the negative factors you mentioned, have been able to trounce or win the fight over the COVID-19 pandemic. But then the government is saying, even though you achieved the milestone of 17.1 million vaccinations, they want to increase those vaccinations with mandatory or compulsory vaccinations. What is your take on the issue or subject of compulsory vaccinations, Samoledo?
Thank you so much for that crucial and very significant topic.
Indeed.
Compulsory. Honestly, let's be realistic. These de novo diseases that are new, where we have vaccines to try to reduce the hospitalization and the critical care, a vaccine is not an end in itself. A vaccine is a buffer mechanism for the body system that you do not have critical and complications when it comes to hospitalization when you're affected by COVID-19. And in all this, before one takes up a vaccine, he has to sign a consent. That has been a mandatory rule because this is a de novo. And one must accept with their own conscience that they're willing and they're given relevant information, all information. We say in medical practice, give a patient as much information as you would give had you been in that situation. There's what we call do no harm to a patient, malfeasance and non-malfeasance. Do no harm to a patient. And the patient have what we call autonomy. Autonomy is they choose what must be given to them. And there is no way you're going to take away the right of the patient to accept what procedure should be done to them or what should enter into their body system, and you dictate on health. We take oaths as doctors. And the Hippocratic oath is clear. Do no harm to your patient. Maintain the level of autonomy to patient and also confidentiality, among others. We don't to force any patient into a medical procedure. And for sure, as Uganda Medical Association, we are saying, no, please, can you sensitize the masses? I'm the president of Uganda Medical Association. I was vaccinated. I even took the booster dose. But why are people not taking up this vaccine? It's because the message has been given to irrelevant people to give the message. You cannot tell me that vaccination message is being given by RDCs, by UPDF officers, by the police. Come on, these are you do not have taken to different community activities to convince and to inform the public of the relevance of vaccination. There are places which are taking up vaccines as fast as possible, the urban areas. We must have a strategy of informing the Ugandans on the relevancy of the vaccination.
Indeed.
We cannot coerce people. You cannot find people basing on what they've chosen not to take in their body systems. No.
Samoledo is the president of the Uganda Medical Association. Samoledo, this government and the way it behaves, Morning at NTV has been noticing it for the last couple of decades. And this is what we know. We know that if this government wants to, orchestrate something into reality, they'll do it. If they want to tweak or change the Public Health Act to achieve something, they will do it. So in the event that government actually gets its way, and we do have compulsory vaccinations taking center stage in this country, what would be the immediate reaction of the Uganda Medical Association? Sam?
It is simple. Our right as doctors is basically to defend humanity and to give a service to the patients of Uganda, the entire Ugandans. You are not twist us into doing things which are unprofessional. We are not going to do that at Medical Association. We are saying no. And when it comes to professional standards in health, please respect the consultants who are involved in this. And in health, we are consultants in this. This is not a matter of paperwork. This is not a matter of policy. This is a matter of life that we are talking about. And as Uganda Medical Association, our recommendation in the amendment of the Public Health Act was there should be no punishment given or coercion to anybody in terms of uptake of vaccines. And this we are saying it very clearly. without fear or favor, when these unfriendly or unprofessional acts are put up, I assure you, as Uganda Medical Association, as doctors, we shall sit down, remain home, and let those who are lawmakers, who have failed to understand that human beings should be treated, they have the alienated right of life. We shall sit home and watch, and they come over and they take our responsibility in the hospitals. This is a matter of life. Please respect professions in that area of expertise. I cannot go into the law court and then I tell the judge to get off their seat and I take over their role. I can't do that because I did not study law. But where we are specialists, respect the mandate of those who are professional guidance in those fields. And as Uganda Medical Association, we shall not bend, we shall not compromise the professional standards when it comes to doing no harm to our patients. We are not going to bend our standards on that.
Aren't you afraid when you orchestrate a sit-in, an industrial action or protest over this, you could be replaced by the central government? We were actually hearing that if you go through with the protest, if government gets its way, they might replace you with army officers, medical army officers to do the vaccinations if the medical doctors are actually against it. Aren't you worried you might lose your jobs, Sam?
We have less than 40 medical officers employed by the UPDF, and those are still our members in Uganda Association. I believe they took the oath, the Hippocratic oath, which tells them very clearly, doing autonomy is mandatory. Malfeasance, among others, they took the medical officers in uniform, in police and prisons. So I would think, with absolute due respect, without fear or favor, they would not be coerced into doing things which are unprofessional. Actually, there will be the not to administer a COVID vaccine to an individual having attained that medical background, and then the patient goes into an anaphylactic shock. An anaphylactic shock is a medical emergency, and you're doing it you're doing it in the market, and this patient will die in front of you without emergency drug or emergency services given. Can you believe that? So this is not a matter of just trying and wanting numbers. Do we have a feeling that probably there's some interests which are associated with this vaccination? Is there something which is unearthed, that is being hidden, that is unsaid? Please, as doctors, we are not going to compromise on professional standards. We are not going to bend our neck in the name of harming patients. We are not going to do that. We swore an oath to save lives, and we shall do exactly that. If they intend to replace us, I told you we have 40% doctors employed. 40%. We have already a staff up of 60%. So now, even if they employ the UPDF right now, to join us right now in the numbers, you not even have up to 50% employed to give a service. I of places where there are no doctors. So does it mean the places where there are no doctors are going to replace some doctors? Please, medical services at Blago. We have the whole country that joins medical service. So this hula-baloo of if you don't do this, we shall replace you. We can intimidate. When it comes to, we studied to become professionals. It takes 7 years to get out of medical school. It takes another 3 years to specialize, super specialize, another 3 years. So it takes someone 10 years to be able to stand on their feet. So there is no way you can force us to do things which are unethical. That is not allowed. And as Uganda Medical Association, we are saying we are going to give professional standards and professional guidance to Ugandans. We shall give services with the right of the patients being honored and put into consideration.
Sam Oledo, aren't you afraid that in the event of this Public Health Act being amended, you might be the first person to fall victim to this Public Health Act? Because you might be branded as a vaccine skeptic, someone who doesn't want to, people to get vaccinated in that regard. Aren't you concerned that some jail time might be coming your way and your colleagues?
Let me make a very big correction on that. We are not saying we to be vaccinated. That's not true. I told you I've got a dose of COVID-19. But we are saying you do not coerce, you do not force, you do not intimidate people to get vaccinated. No, I did it because it is good for my body. And it is protected to my family. And doctors have done this. They've taken up this.
Indeed.
But COVID-19 vaccination is a right of an individual to consent. I consented to get this. So why don't you allow people to consent? Give Ugandans as much information as possible and do not force them to get the vaccine. Let them come willingly, consent, sign, and allow to be vaccinated, as we did. So we are saying, as Ugandans, to get a vaccine. Why? So I think the method of operation here have been very alienated to humanity, so we need to revisit the methods of operation. Can we engage more health workers? Can we engage doctors to talk to the communities, to sensitize them of rightful need of this, and we stop irrelevant individuals? You cannot get an analyst to talk about COVID-19, honestly, on a radio talk show, on a TV talk show. You cannot invite community leaders to talk about medical conditions which require deeper understanding and deeper sensitization. Can we engage more masses into the sensitization drive, doctors and professionals into the sensitization drive? And we are saying, please, give information and let Ugandans accept to be vaccinated. No coercion as Uganda Medical Association. We are not intimidated and we shall not bend on issues which are professional. Please, we are not going to do that. We stand on our professional product and we shall defend that as doctors because it is the reason why we are giving services to Ugandans.
Sam Oledo, besides the coercion of our citizens into submission to get these vaccines, what else can the government, employ as a model to ensure that our citizens actually get onto these vaccinations drives, if you will? Alternatives.
Get your question to us, not very clear, please.
What other ways can governments get people to get vaccinated other than coercing them to do so?
The best way, I've explained it very well. Can we have a lot of community sensitization groups? Can we have these interest groups, have doctors, nurses, all of in different, go down deeply. Let Ugandans understand the rationale. Not just bring vaccines and you tell Ugandans vaccines are in the facility and you expect them to come. Actually, to our girl children, we've not done enough sensitization, even in the secondary schools. We've not done enough sensitization in the primary schools to talk to our girls that please, this in later lives can cause a lot of complications like cervical cancer can emerge. We have actually HPV vaccines in the stores of national medical, stores. It is other have never been taken up. So the strategy of sensitization, very big challenge in Uganda, because I believe in Uganda where the allowances involved, there are individuals who are earmarked for allowances. We don't want your allowances, please, in issues of vaccination. No. As doctors, we don't want. What we want is, can you give us the mandate? Can you equip the doctors and the health workers with the mandate to do community sensitization? Enough of community sensitization. These markets are always running in the different places. You do not find any community workers coming to the markets to sensitize the markets of the need of the COVID vaccine uptake. And yet you find these markets are seasonal in these different places. People are moving in different places, but we've not engaged them. Now we are saying we fought. Have we done enough into sensitization? Have we involved the relevant people into the sensitization drive to sensitize them about this? And this is what we are saying. Actually, I was very perplexed. The president of this country,
yes,
General Yoweri Kaguta Museveni, has done a great job when it comes to security, peace, and stabilization of the nation. I was looking through national tweets whereby the first son, General Moses Kainerugaba, I think would have interest to come and contest as president. And for sure, what has a challenge in this government of ours has been service delivery. If service delivery is improved, actually, this ruling party can stay even for ages, for 1,000 years.
Sam Oledo, you mentioned something on community awareness raising. Sam Oledo, you mentioned something on community awareness raising. Is it going to be a success given the fact that we have a staffing gap of 50%?
Actually, the community awareness program is one of the things that we included in our amendments. in the Public Health Act that we must have, there are diseases that can be prevented at community level. Actually, COVID-19 preventative measures, the SOPs, help to reduce diarrheal diseases up to about 7 just by hand washing. There are diseases you can prevent through community sensitization, involving communities into their own matters of health. Public health talks about community involvement, and we've left out community participation totally in this. And we're saying, can we have the professionals go up to the communities, sensitize the communities on the uptake of the medical services, not only vaccination, but other medical services that are available. We need, actually, we are very perplexed that even diagnostics are not available in these hospitals. You do not expect, for example, a mother who has come in labor, and you just use clinical assessment and physical maneuvers on a mother, and you just think this mother is actually due for SVD pushing the baby.
Samoledo.
There is no, there are things in place, things like ultrasound.
Okay.
So we are talking about a holistic approach. So community sensitization amidst other health approaches are key.
All right, Samoledo, before I let you go, yes, this is the $64,000 question, Samoledo. Where is the problem? What is the problem, if you will? Is it that this country doesn't have money to bankroll the health sector, or is it that we have mafias or unscrupulous people who are stealing government money and equipment or resources, if you will?
The biggest challenge we have is majorly one. We are misinforming the Fountain of Honor. People go and meet the Fountain of Honor and tell him, Your Excellency, everything is okay, because they want to be in good books to the Fountain of Honor.
All right.
They always inform, Excellency, we're doing a great job. Services are on point. Hey, allow me to say this. I am sure of Honor could be watching. Your Excellency, service delivery is poor. I speak this without fear. Please, let's stop misinforming.
All right, Samoledo, thank you.
So the biggest challenge is our people make policies in Kampala, they stay in SC offices, they rotate around Kampala, and they are not on ground. They do not go down on ground to see the Wananchis. What is actually, I was shocked when I was in Arua. The president went in Arua, and we have a fruit factory in Arua, West Nile. And shockingly, he had gone to commission that fruit factory about 6 years ago. Because the Fountain of Honor was coming to Arua, they had to bring equipment from Kampala and make sure that the factory was running for 6 hours. Can you believe that? 6 hours. When the president was leaving Arua going to Kampala, I think the machines reached Kampala earlier than him. And we are busy here. Whom are we fooling?
Samoledo, thank you so much. Samoledo is the president of the Uganda Medical Association. It comes with a wealth of information. We shall have to seek for your services. That is a part 2, so that you give us some of more of the information pertaining to the health sector. Thank you so much, Samoledo. And of course, to you who has been watching Morning at NTV from 6:30 a.m., thank you so much for that undeterred love and support. That conversation has been exhausted by Samoledo, largely focusing on compulsory vaccination. He says they would rather actually orchestrate a protest and not go to work rather than putting the lives of those patients in danger, giving them a vaccine they do not want. Well, we also do have Robert Sempala, the Executive Director for the Uganda Human Rights Network for Journalists, coming to us later on with the information pertaining to the Digitalk alternative journalists who were actually arrested on Thursday last week. That